Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today I want to welcome Thomas Richey, a nurse practitioner practicing in our Wharton location with Oak Bend Medical Group. Growing up with both parents in the medical field, Thomas Richey has been and worked in the medical field for most of his life. He graduated summa cum laude from Texas Chiropractic College as a doctor of chiropractic and BS degree in human biology. Thomas has certification in acupuncture and sports medicine. He is also trained in ultrasound injections and pain management. Thomas practices family medicine in Wharton, Texas, and we are happy to have him here today. Thank you for being here, Thomas.
Yeah, I'm proud to be here.
Thomas, you are a nurse practitioner, chiropractor. You do DOT physicals, workman's comp, family medicine, acupuncture, ultrasound guided trigger point injections, and sports medicine. Tell us how you got involved in all these things.
Basically, like as you gave me the fantastic introduction, is I grew up in the medical field. My father's a radiologist. My mother was a nurse at St. Luke's Hospital. She was one of the nurses on the head floor for cardiology, specifically Dr. DeBakey. I met him when I was about 14 years old and got to watch an open heart transplant. Kind of opened the door for me being in the medical field. I was starting on my track to become an MD, but got sidetracked when I decided to have a family first, and chiropractic was the option. We treated regular injuries for the first few years I was a chiropractor, and I became to know that this was a limiting field, being able just to treat those musculoskeletal injuries as opposed to treating something else that any other person in the medical field would treat. At that time, I set my goal to expound my knowledge and learn as much as I could to care for patients in the way I feel they deserve to be cared for. I began first just by learning acupuncture and sports injuries. I did on-field work at some sports places, but still, this was a limiting field. Nobody wants to have to treat a musculoskeletal injury and then refer it to somebody in the medical field just to be prescribed an anti-inflammatory or a steroid. And at that time, I decided to sell my practice and go back to school, I went first to nursing because I felt a nurse practitioner was my best option, especially with my age. I graduated near the top of my class for that and finished my master's and became a family nurse practitioner. But even at that time, I felt limited. So I even added more onto my field. I learned more about radiology and MRIs and ultrasounds, as well as I got certified in doing DOT physicals and workers' comp. I felt that's the best way to give the patient everything they could, as well as expound my knowledge on the whole goal was taking care of the patient. That's my whole goal in my life. Nothing feels better than to see a patient thank you. That's just the ultimate pride.
That is awesome, and we need more Thomases in the world.
Thank you.
Thomas, you touched on you did acupuncture, and I hear a lot of patients ask about it. Is that a part of natural medicine? I mean, does it really? What does it work for? What does it do?
Acupuncture has a lot of uses. I don't know if I agree with all of them, but I have treated a lot of different complaints with acupuncture over the years, and I've seen where it's given me very beneficial results, especially with stress, migraine, headaches, neck pain, any type of joint pain. I've seen it help with sinus infection. I've seen it help with weight loss and smoking cessation. So there are things that would put it in that natural or holistic type category. Somebody who doesn't want to use, for example, Zyban or something of that nature can be treated with an acupuncture type, either pressure point or in the acupuncture needles. Those are just different ways to expound on the knowledge base that I tried to learn.
Awesome. And then what ages do you see in your clinic?
We treat all ages. Why discriminate? My whole thought is, if they need something, let's take care of it. If we can't take care of it, I'll get you somewhere that you can be taken care of.
And I understand you also do make rounds in the hospital.
Yes. Currently, I round with Dr. Ceballos, who's just an internal medicine specialist, great physician. He's part of the Oak Bend group. I've learned a lot from him already. And then I also round with a Dr. Cal. He's our cardiologist. And he does procedures, caths, those kind of things, and already have learned from him. So this place is a godsend. It will help you learn and push your knowledge base more than any person or any place I've ever been with.
That is great. And now you've kind of set up your own clinic in Wharton, and you're actually officed in the hospital, in your own office.
Yes, we are building onto that, but we are pretty well open, and we're seeing patients already. We hope to expound on that and bring in more people, but we are beginning, and we have to start somewhere. So let's start.
So what do you think? What do you want? Let's put it that way. What do you want the listeners to know about you and your passion for patient care and your thoughts?
I believe in putting myself in their shoes. I feel the best way I have ever seen about making somebody comfortable is to connect with them, personal base, or some type of familiar field. Especially in the area we're in, there's probably a lot of hunters. I'm a hunter. Some people are in different fields. I've connected with as much people as I can. I want to have them become part of our family community. I want them to feel at home when they walk in the door, not address me as some high and mighty person. I want them to be able to talk to me face to face like a friend. That's my whole goal.
So why would a person choose a nurse practitioner rather than go to a doctor?
Personal experience. Most nurse practitioners learn from the doctors. They are very knowledgeable. Most nurse practitioners will surprise you, and that's what I've seen in this field. I've been around some very, very intelligent people in this medical field, nurse practitioners and MDs. Trust me, I've seen them give knowledge that I never thought they would have. But yes, treating a nurse practitioner and an MD, some people will still preserve that fact that they would request the MD, and we feel completely comfortable in providing that. But I'm here. I'll help you. I'm in the area. If you need me, give me a call.
You know, just from the other side of it, I have seen a nurse practitioner for my health. And I have to say, sometimes I find nurse practitioners to be more laid back, maybe listen a little bit better sometimes, and be just as good as a physician. And nurse practitioners also know their limitations. So I want the general public to understand that nurse practitioners can do just about anything. They work under the supervision of a physician, and usually your experience is very well. Thomas is very friendly and does a great job at that. Thomas, can you explain what DOT physicals are?
DOT is an anagram, of course. DOT means Department of Transportation. It's where somebody who drives a commercial vehicle would come in and has to be tested and certified under that program. This is an extensive evaluation for the person requesting this exam. It follows their guidelines, not mine. All of this has to be filled out per their guidelines, and it's not the state guidelines. This is a national guideline, and it has to be uploaded onto their website before persons doing DOTs or driving a commercial vehicle can renew their license. Everybody has to follow this if they're going to drive a commercial vehicle.
Great. And then what is your opinion on everybody needing a physical, and what ages and when should they go for their physical?
Physicals, everybody should have a physical. Physicals are needed to not just show how healthy a person is, but also to find underlying problems that most don't even know they have. We treat everything once we deserve and find out what the physical entails or what shows us through either an evaluation or blood testing. Any of those chemical findings could give us a clue as what the patient may have that they had no idea. So treating somebody after a physical is a priority.
So I'm going to put you on the spot a little bit here and ask this question.
Okay.
If you have children in the family and you have a strong family history of diabetes, heart disease, or medical issues, when do you recommend getting your children in to have a baseline or a physical or anything? Because I hear diabetes, heart disease, those are always hereditary.
Mm-hmm.
And can be. So when would you need that baseline?
I think treating everybody as soon as possible that have some type of familiar history of either cardiac, diabetes, those type of findings. That's something that should be addressed immediately. Diabetes, like hearts, cardiac problems, are silent killers. They attack us and we don't even understand it. You may just feel fatigued, and that could be a part of the diabetes that's beginning its own trek.
So are you thinking maybe 16
Even
years
earlier,
old?
I would think 14.
Okay.
Right at the end of puberty, somewhere in that age.
Awesome. Okay. And that's very important because we just met with Dr. Picard, and she had said diabetes has been around your system up to 10 years before you even know you got it.
Correct.
So we want to make sure our kids are involved because it's not a matter of if, it's a matter of when. So
if you have two parents, specifically, if you have more, one parent is one thing, but two parents, chances of you having diabetes is very, very severe or very extreme. I would probably put it above an 80% category. So testing early, controlling it early, putting somebody in that type of management is going to be the best thing you can do for your patient.
That's great. And to our listeners, if you have children in your family and a strong family history of any disease, get them to Thomas so we can start baseline and checking them out even at 14 years old. So we can make sure we keep them healthy and maybe prolong and have a long, happy life. That would be great. Thomas, is there anything else you'd wish to tell us today?
Just that being a part of this family is enlightening. You'll need to come see me if you want to know anything else about that.
Thomas, thank you. It's always a pleasure talking to you. Thomas has this great personality and a real joy to be around. Please make sure you see him. He is out in Morton, and he's waiting to see you. Thank you, Thomas, for joining us today. And a big thank you to all our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week. Have a great day.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.